welcome back to my channel. My name is Brianna and I'm back with another video. So my previous video, I said I was going to talk about my medical issues, and I broke it down into 3 different questions. So let me go on with the first question. Remember to like, comment, subscribe, and I'm not a medical doctor. This is just my experience of what I've been going through past few years with my weight gain. So the first question is, when did my weight gain start? So I was fairly a normal weight all the way up until I turned 10 years old. I started putting on weight. I had a lot going on in my life. I ended up living with my father, and I went through a period of depression, all that, childhood depression, all that jazz. I started putting on weight then, and it continued on. I had never been smaller than 200 pounds. I can't even tell you when. So next question was, what caused the weight gain? Okay, so I didn't always have the best diet growing up. I used to eat whatever I wanted. I was spoiled. Yeah, I didn't have the best diet. I am a bookworm. I love to read. I love to sit. So I was sitting a lot, and that's what contributed to the weight gain. Over the years, it just got, worse and worse. I didn't play any kind of sports or anything when I was in school. I did play soccer when I was 10 years old, but that was about it. I never did anything physical after that. Even now, my job is mostly sitting, so I have to definitely change that lifestyle, which I have. I've incorporated more walking, general exercise. I like to take my baby to the store, so we'll walk around the neighborhood. I was going to the gym, and I still can. I can't make no excuses, but let's answer the next question. Let me touch on also the fact that I was an emotional eater and a comfort eater. I'd eat, doesn't matter when. Like, I love food, so that was a really big thing that also contributed to the weight gain. I can't sit up here and say that I don't like to comfort eat, because I do. And food is not supposed to be used in that manner. It's supposed to be used just for sustenance, just for nutritional purposes. But, we all have our, problems. So it is what it is. The next question I have on here is, what are your medical issues that are related to your weight gain over the years? So I didn't find out that I was diagnosed with PCOS until 2014. I found out through routine blood work, labs. I had stressed to my doctor that I was having a lot of irregular menstrual cycles. Like, I would go 4 or 5 months without a cycle. That's a long time to go. So we ran some tests, and she did a ultrasound of my uterus and found polyps on my ovaries. Polycystic ovarian syndrome is very common. A lot of women go through it, and it is attributed to, weight gain. There's a lot of other symptoms. I had a lot of symptoms related to PCOS: acne, weight gain. I'm frequently tired. It's hard for me to lose weight. They say that cutting out carbs really helps people with PCOS. If there's anybody else out there with PCOS, there is hope. There is no medicine for it, but they say weight loss helps managing PCOS. I also had an issue with high levels of prolactin in my bloodstream. So let me back up. After I did all those tests, my doctor says, I did a blood test, and you have higher levels of prolactin than normal. So I said, well, what is prolactin? So I started doing my research, and prolactin is what your body makes to produce breast milk. Mind you, I thought it was normal. I had, this is gonna be TMI. I had milk production well before I was pregnant with my daughter, well before. I say it started when I was like 15, 16 years old. And I just thought it was normal because I had never dealt with anybody else. I never talked to nobody about it. So when I found out that it wasn't normal, they did the blood work. They sent me to an endocrinologist. Endocrinologists specialize in dealing with the pituitary gland. So I ended up having an MRI done of my brain. Well, not my brain, but of my head. And the pituitary gland is about right here. It's not in your brain. Excuse me, I'm not a doctor. Again, I'm gonna stress that. But when they did the scan, they found a 9mm pituitary gland tumor. It was benign, meaning it's not cancerous, and it's fairly small. 9mm is not that big. So they didn't want to do surgery, but instead they started treating it with a medicine that's supposed to help shrink the tumor and stop the production of prolactin. So pituitary gland has a lot of hormonal things that it deals with. And so with that tumor being on there, my hormones were out of whack. It's also contributed to me not having a menstrual cycle for the past 2 years. You heard that right. I haven't had a menstrual cycle in over 2 years, and that is due to the tumor. When COVID happened, a lot of my doctor's appointments got canceled, so I couldn't go and see my regular, endocrinologist, my regular doctor, because of COVID. They weren't accepting patients. I ended up not getting a refill on the medicine due to the fact that my doctor had to see me in order to refill the medicine. So yeah, I rehabbed on my body, but started this year with going back to the doctors and starting this process for VSG surgery. I was able to check on it. It hasn't grown. It's still the same size, and the prolactin levels are steady going down due to me retaking the medicine. So thank God for that. And I also have other issues like I'm pre-diabetic, I'm pre-hypertension, and those are just issues that come with the weight. So hopefully having this surgery is really gonna benefit me in a lot of ways. And I think that's it for this video. I hope I answered, anybody's questions about my medical issues, but I just wanted to disclose this stuff. I do hope that VSG surgery is gonna help. It's probably not gonna cure everything. Like I said, PCOS, there's no cure for it. So I'm hoping to better manage it and treat the symptoms that I have with the reduction of weight. So thank you for watching this video again. I will have more uploads for you. I'm 9 days away from my pre-op class. I'm definitely gonna be documenting that stuff. So thanks for watching, and catch me next time. Bye.